Hello and welcome. My name is Wilfred Mgwa. I am an infectious disease epidemiologist and microbiologist. I am also the founder of EpiGuider. We are in lesson 2 of our course, Setting Up a Monitoring and Evaluation System, with a particular focus on health programs. In this lesson, we will be focusing on the setting up of a monitoring system. Let us now look at a rundown of points we will be discussing in the course of this lesson. We shall look at the key pillars of a monitoring system. Since our lesson employs a practical way of doing things, we shall give a detailed description of the case study we mentioned in one of our previous videos. I have come to learn that it is better to do things slowly and do them well rather than rush and mess things up. Let me explain what I mean. A common error most epidemiologists or monitoring and evaluation officers do make is the rushing to create a monitoring system. Sometimes the result is a quite fancy monitoring system, which of course does not fulfill the purpose a few weeks or months after implementation. To avoid you making this error, we shall look at the things to consider first. Then we shall walk around each of the pillars of a monitoring system, using our case study as an example to set up our monitoring system. As you can see on the slide, we will be breaking down this lesson into two parts. The first part, which is the focus of this video, will cover the key pillars of a monitoring system, a detailed description of our case study, and the things to do first. And then the second part will focus on walking around each of the pillars to set up our monitoring system. Let's now discuss the key pillars of a monitoring system. As you might already know, a pillar is needed to hold a building firm right from the start to the end of the building's lifespan. In a similar manner, monitoring pillars are essential throughout the lifespan of the monitoring system. That is from the start to the end of the project. The first pillar has to do with defining the minimum indicators or the minimum data set. To monitor our project, we will need to decide on the minimum indicators required to have a clear tracking of our project, and then make sure that we collect the information or the data we need to calculate these indicators. Indicators are generated based on program objectives. The second pillar has to do with the compilation and collection of data or information. Indicators are calculated using data, and thus the data has to be collected. In this pillar, therefore, we are talking about the source of the information, which could be patient files or registers. You want to make sure that your source of data has the information you need and has it in a way that can be easily extracted and aggregated for reporting. The third pillar has to do with the use of data or information for programmatic decisions. You want to make sure that everyone is involved in using the data and interpreting the data. When I talk about everyone, I'm talking about the different departments that make up the project. Could be the supply team, the human resource team, the medical team, the logistics team, the financial team, and what have you. But it's important to remember that different people use data in different ways and for different purposes, and therefore you may need to have it in different formats. Cutting across these pillars are three sub-pillars which are needed to make your monitoring system quite strong. These I have highlighted in the yellow boxes. The first sub-pillar is routine training and support. You want to continuously train users of your monitoring system on how to use the system. In the course of these trainings, you might also identify areas you need to modify and improve. Team members also feel involved and thus motivated. The second sub-pillar has to do with ownership and accountability for data completion, accuracy, and management. This is where data quality audits come in handy. You want to do regular audits of your monitoring system to identify strong and weak areas, provide feedback to the users, and make improvements. In one of my audits, I realized age was always missing. Feedback from nurses was that most parents were uneducated and did not know the age of their children. So as a solution, we worked with age categories instead of exact age. By age categories, I mean 0 to 5 months, 6 months to 11 months, and 12 to 60 months. The third pillar has to do with setting aside protected time to capture, extract or produce reports and do some meaningful thinking about the data. When I talk about meaningful thinking, this is the point where you want to present the data to team members. Let's now have a quick reminder of our case study. A local NGO, EpiGuider, carried out an assessment in country A for the year 2017 and obtained a crude mortality rate of about 0.8 deaths per 10,000 per day and an order 5 mortality rate of 1.65 deaths per 10,000 per day, and identified malaria as a major cause of death among children under 5. EpiGuider developed a package of health activities which includes a free community and health facility management for sick children under the age of 5. You have been engaged to set up a monitoring and evaluation system for this NGO. How do you go about it? Let me provide you with some more information about our case study. The title of our project: Health Facility and Community-Based Management of Malaria and Malnutrition in Children aged 0 to 5 years in the district of Bolu in country A. The reasons that motivated the creation of this project were: 1. Very high malaria incidence, 2. High severe acute malnutrition rate, 3. Low immunization coverage, and 4. High infant mortality. The organization of the Bolu district. The district of Bolu has 12 sub-health areas. Health areas make up a district. Each health area has a health center, so there are 12 health centers in total. One of the health areas, which is identified as the capital of the Bolu district, has a district hospital in addition to a health center. EpiGuider had as general objective to reduce the morbidity and mortality among children aged 0 to 5 in the 12 health areas of the Bolu Health District. At community level, EpiGuider aimed to make use of community health workers to provide free quality care for simple malaria, diarrhea, and also the systematic screening for malnutrition. At the health facility level of health centers, EpiGuider aimed to provide free quality medical care for diarrhea, malaria, respiratory tract infections, and malnutrition. At the level of the district hospital, EpiGuider aimed to provide quality management of cases of severe malaria and other associated pathologies. So here we are, things to do first. You have now resumed duty and ready to set up your monitoring system. What are those things you want to do first? You want to discuss with key members of your team, the medical coordinator and project coordinator, and maybe ask them to invite other key members that they may think can provide you with some useful information. Make sure at the end of this discussion you understand the organization of the project. You have some existing project documents like the project document and the logical framework. You also want to have knowledge about some existing tools, forms, databases, and also you want to be sure that you know how the team intends to use this data. Once this is done, you now go back to your office, sit down and read through the project document, the logical framework, which normally should contain the indicators of the project, and also read through some health reports if any is existing. Here we are. You now want to plan some field visits to the district hospital and to health centers. Your aim is to understand the organization of the hospital as well as the health centers. You want to look at existing registers and to have a workload assessment, data related to be specific. At the end of these things to do first, you will have a clear idea or ideas on how to develop your system. In our next lesson, we will be working around each monitoring pillar to set up our system. Please remember to subscribe, like, share, and comment. Thanks for watching and see you in part 2 of this lesson.